Welcome to Women's Health. This is Tracy, and we are going to cover the Introduction to Women's Health, which covers chapters 1 through 4 in your maternal child nursing care, Perry, Hockenberry, Loudermilk, and Wilson textbook. And this will help you prepare best for your first online exam. So we're going to go ahead and get started and taking a look at Objective 1, define the role and scope of the registered nurse in women's health. When you're thinking about women's health and you take a look at what's up on this slide, women's health care really focuses on the physical, psychological, and social needs of the women throughout their life. Maternity nursing encompasses childbearing women and their families, and it takes them through all stages of pregnancy, including through the first 4 weeks of life. When you are providing care during those childbearing years, ensure that you're using culturally sensitive care and meet the healthcare needs of our culturally diverse society, because as you get into nursing and you're out there in the field working, you will come encounter with several different cultures, and it's important to be cognizant of what types of care these women are going to need. Some of the important history behind women's health. If you take a look in your book, you will see that Semmelweis was really important for hand washing. And with that, what Semmelweis did was medical students had been working on cadavers, and then they would come up to the OB wing, and without washing their hands, they would do sterile, quote unquote, sterile vaginal exams on women. And so over time, Semmelweis realized that, hey, maybe hand washing is correlated with infection rates. Had those students start washing their hands, and we saw a dramatic decrease in infection rates. With Margaret Sanger, she established the first American birth control clinic in Boston, New York. In 41, the Pap test was introduced, which is extremely important to women's health nowadays. It's very important for an early intervention. Early detection means early treatment. Virginia Apgar was an anesthesiologist who published the Apgar scoring system. And as we move throughout women's health, you will understand more about what the Apgar of a newborn means and how we utilize that in women's health and newborn. In 1960, the birth control was introduced into the United States, and that's also important as we take more focus to current health care, where we're trying to prevent rather than control disparities. And then in 1974, the first standards for obstetric, gynecologic, and neonatal were published. And that's going to be very important to you with NACOG standards, and if you decide to go into maternity and women's health nursing. Remember about Healthy People 2020, and that as we take a look at Healthy People 2020, we're trying to improve the health care of the United States. We want to increase the quality and years of healthy life and eliminate health disparities. With the Millennium Development Goals, there's 8 goals to be achieved by 2015, and those goals are listed out in your book on page 5 if you'd like to take a look at those. Never events that you do need to be aware of in women's health. We never want an infant discharged to the wrong person. I can't express these enough to you. Artificial insemination with the wrong donor sperm or egg, death or serious disability associated with hyperbilirubinemia, and maternal death or disability associated with a low-risk pregnancy. So be cognizant of what those never events are, because those are things that you as a nurse can control. Objective 2, discuss the role of the nurse in family community-centered care. We're obviously seeing a shift to ambulatory settings and trying to focus on home care to decrease costs. With family-centered care, you need to think about that culturally. So obviously mom, dad, children, or partners, and then grandparents, extended family, friends, those types of things are going to be very important. With home care, we're seeing increases in demands because there's interest in family birthing alternatives, so looking at midwifery. The decreased length of hospital stays. Our moms that have normal sterile vaginal deliveries typically only have 48 hours, and those with C-sections have 72. So those are going to be things that we need to take a look at. With new technology regarding home care, we're seeing more in-home alternatives for families to use when they're bringing these newborn premature babies home and then trying to take care of them at home. The downside of home care is that, we decrease the acuity and not really the acuity, but we decrease that hospital contact with them. So it's going to be really important for those community healthcare nurses to have great understanding of women's health and how to take care of these folks once they're discharged home. Terms that you need to know are listed out on this slide. I would take a look, make sure that you know what these terms mean, because they will be utilized throughout women's health, and they are very important for you to know. Objective 3, identifying current trends that have led to the development of family-centered care. We talk about evidence-based practice, and it is extremely important to have evidence-based practice and to remain current with the standards of care and the evidence that is out there. Composition, structure, and function of the American family, obviously healthcare cost. The new healthcare reform is focusing on disease prevention and health promotion, not necessarily thinking about treating the disease itself. So what we'd like to see with the healthcare reform is a shift in our thinking and having people take care of themselves. So in maternal and women's health, how is that pregnant woman going to take care of herself? What are some things she can do to increase her outcomes during pregnancy? With the limited access to health care, you need to be thinking across the nation, across the world, do women have access to the health care that they need? Fertility trends and birth rates, we're seeing huge leaps and bounds in fertility methodology, and we're seeing advanced maternal age. We're seeing our birth rates kind of fluctuate with those. Technology trends, you all know you're from the technology era and how much technology influences life. With the high technology and the advances in scientific knowledge, we're seeing a lot more high-risk pregnancies that have contributed to the cost of the healthcare system. So with maternity care, we do want to extend the preconception counseling and, really educate mothers on the scientific technologies that are out there. Telemedicine is really a great resource for those of us that have limited health care. This technology really has the potential to save billions of dollars across the board annually. With the increase in high-risk pregnancies, I did just mention with the technology and fertility trends. Objective 4, assess and apply social, legal, ethical, and cultural issues related to family-centered care. With social, you need to be thinking about what the family composition is. So who makes up that family, and how are we as healthcare providers going to incorporate them and include them in the nursing care that we provide. The legal aspects that you do need to be aware of are HIPAA, and with HIPAA, you need to remember that especially in this small area, we don't want to share that information. We don't want to share information about our patients to anyone else outside of the hospital setting and to those that need access to them. With domestic violence, we are mandatory reporters, and we will see an increase in domestic violence oftentimes during pregnancy. So it is something that with each and every single visit, we are asking those moms when they're coming in during their pregnancy. With ethical issues, elderly parents are conceiving children. We're seeing older women, parents having children, and with that, look at the outcomes that maybe some of those newborns are going to have. HIV positive mothers using assistive reproductive services. What are your thoughts on that? Do you think that should happen, not happen? Reproductive technology, as far as with the reproductive technology, in vitro fertilization, the quote-unquote test tube babies, how reproductive techniques are occurring in the 21st century, and then also with stem cell research, and we can discuss this a little bit more in class. Cultural aspects, be aware of these cultural terms that you'll see up here on your screen. Be aware of the different types of families, so the nuclear, extended, blended, and married families, and then the different types of culture, subculture, acculturation, assimilation, and ethnocentrism. Choose nursing diagnosis and interventions related to educational needs of the family. These are just a few of the nursing diagnoses that are in your nursing diagnosis handbook that you'll be using for the clinical situation. But do be aware of what your patient needs are so that you're able to write and think about appropriate nursing diagnosis for each patient that you'll be taking care of when you go to clinical and when you come in contact with them and help provide care for them. With pregnancy, these are continued interrupted family process related developmental transition of pregnancy, nausea. There's several more listed out up here for you to take a look at. And like I said, these are all in your nursing diagnosis handbook, and you can utilize that when you go to the clinical setting. I'm going to stop here, and then I will finish up with the last few slides in the second presentation. We will discuss some of Unit 1 in class, but please take a listen to this and be prepared to come and discuss this in class when we meet for the first day.